Hello, everyone, and welcome to the second episode of The Eighth Nerve. I'm Ella Rohoff, and I'm in 10th grade. As we went over in episode 1, I am taking a personal project, IB personal project class, and basically this podcast is my project, and it had to be personal to me, which we went over completely in episode 1. We talked to my dad, who had a brain tumor on his 8th cranial nerve, hence the name of the podcast. So go take a listen to episode 1 if you have not already, but welcome to episode 2. Before we begin, I do have to mention that this podcast is strictly for informational and entertainment purposes. The content I offer is not professional medical advice and should not be used to replace the input of a licensed physician or another qualified healthcare professional. Use the information provided in this podcast to your own discretion. That being said, in today's episode, we will be interviewing an expert in the field of, medicine, regenerative medicine, who will give us professional insight into regenerative medicine. So we'll be interviewing Dr. Welch. He works at the University of Michigan as a surgeon in the Department of Otolaryngology, head and neck surgery. He was one of the surgeons who operated on my dad last March. Very grateful for him and his team of surgeons. So from here on out, well, actually, let me start by saying, Dr. Welch, this is a pre-recorded interview with Dr. Welch, from a few weeks back, and he was driving, home from work because he's just so busy that, his schedule's so crazy as a doctor, so it was very generous of him to give up his drive home to talk to me and to give his professional insight to me and all of you listeners. From here on out, I think I'll let him speak for himself. All right. Welcome to the podcast, Dr. Welch. We're gonna start with a few icebreakers. So can you just start by telling us a little bit about yourself, your job and your hobbies?
Sure. Well, thanks for the invitation. I am a physician scientist. So I have both a medical degree as well as a PhD in pharmacology, and I am an ear surgeon. So I take care of disorders of hearing, balance, um, and all things in between. So I'm a very subspecialized physician of ear, nose, and throat surgery. So we take care of most of the disorders of the head and neck, but I picked the ear because I really enjoyed the ear and all the things that go along with it. And so I've been out in practice for 5 years now. I work at the University of Michigan, and I really enjoy what I do. Outside of being an ear surgeon at work, I have a family. I got 2 kids. I got a 6-year-old and an 8-year-old, and enjoy being with them. Some of my other hobbies, I really enjoy cycling. So I'm an avid road and dirt cyclist, and have been doing that for about 20 years. Enjoy long rides. Um, have done several 100-milers over the course of my life. And I'm also a violinist. I play violin and have an orchestras and currently play at church. And probably my other big unusual hobby is I really like birds and have since I was a little kid. So I particularly enjoy going out and seeing new birds or things that come through the area on migration. So that's been a long-standing passion.
Wow, well, a man of many hobbies, clearly. How did you initially become interested in the medical field?
That is a long journey. So when I went to college, I anticipated that I would study birds. That, as I say, that was a hobby of mine. I thought that would be really cool, and I'd better understand bird behavior, migration, all these things. And I did that for about 4 years when I was an undergrad student. I worked in a lab. I did a lot of work on studying how birds migrate. But I realized that I liked that a lot for a hobby and not so much for a job.
Gotcha.
Took took some of the joy out of it. And I think what I missed and what I was looking for was human interaction, human touch. I think I've always thought something where I could serve others and help other people. And so I got interested in medicine largely from the research side of things. So I knew I could do research. I'd done research. I thought doing biomedical research was interesting. So I ended up pursuing a combined degree program where I would do research, but also get a medical degree. And I thought I would focus on drug design and development to help people with different medical conditions. Didn't know what, but that sounded pretty cool to make new drugs to treat different conditions.
Yeah.
Um, I was in that program for 9 years, and I probably changed as a human being. So what I thought I would do when I started was not surgery, and yet by the end of it, I was just really captivated by what we could do with our hands, what we could do with surgical techniques, the skills, the gifts of life, the quality of life that we could restore through surgical treatment. It wasn't all just like disasters or medical nightmares or emergencies. There were a lot of really neat things that we could do. And that drew my interest into ENT, and that's how I ended up where I am after about a 14-year journey in the process.
Dang. Yeah, that's pretty crazy. So kind of going like more into the like transitioning into the medical aspect of it. Can you just give us like a very like general description of regenerative medicine before we get into the more complicated aspects of it?
Yeah. So I think a good way to think about regenerative medicine is we want to take what the body already has and regrow it or restore it in some fashion rather than use artificial parts or mechanical substitutes. I think we think that our bodies work well the way that they do, and when they go bad, the things that we have to substitute for those things don't work quite as well. So if we could
Yeah.
harness the body's ability to regrow, restore, or create new ways to do those things of the body's own natural tissues and cells, that would probably restore function better than anything we as humans can currently create mechanically.
Interesting. Yeah, pretty pretty complicated. But yeah, we'll get into that a little later. So as I talked about with my dad on the first episode, and as of course as his doctor, you already know, um, so his vestibular and his auditory nerves were extremely damaged during his surgery, meaning that his balance and his hearing were both majorly affected. How does this affect his health now and in the future? And are my dad's hearing and balance functions going to get better?
Yeah, that's really good questions. So I think the last question you ask is probably the easiest one, which is also the most disappointing one, right?
Yeah.
Uh, we took out this tumor, which was off of the balance nerves and directly impacting and causing injury to the hearing nerve. And those are not going to recover. The nature of the surgery that we did to protect and preserve other functions necessitated that we take away some of those other functions. So there was sacrifice to hopefully get preservation, but the hearing, the balance function in that ear are never going to return in any
Right.
meaningful fashion. Um, and yeah, remind me of the first part.
Um,
Sorry.
oh, just like how does this affect his health overall? Just kind of tying into the second question.
Right. So it's important, and I don't think we have really thought about it well over the course of kind of medical history. In the past, people would be deafened or lose function in the side, and we said, well, that's why you got two, right? The other will compensate, pick up the
Yeah.
slack, be fine. Um, we've learned over time that that's probably not entirely true. And while there's no really life-threatening consequences from those things, it probably does have consequences. So there's been a few studies that have looked at big populations, like United States population level studies that have shown that people that have increasing degrees of hearing loss have greater degrees of dementia. So Alzheimer's, things along those lines. If
Oh,
you've got a greater degree of hearing loss, those seem to predispose you to having these problems with dementia down the road. And if it's not rehabilitated, if you don't get a hearing aid, if you don't do things to help with it, what it probably does is causes you to isolate socially. So if you can't hear people, if it's hard to converse in a busy environment, If you're at a restaurant and you can't understand whatever, the joy comes out of those conversations, and so people withdraw. The same is probably true for our balance function. So you, me, your dad, physically active, get out, do things, can usually bounce back and recover. But there are places where it's still not going to be perfect. And
Right.
as we age, that gets more dangerous. So one of the most common causes of injury to elderly individuals are falls.
Right.
So now it may not be so consequential, but down the road, as we age, we get more difficult. If you have only one system to rely on, you're probably at greater degree of risk for falls. And those cause significant injury and in some cases death for older people. So we think carefully before we cost somebody those functions because it probably does have costs 20, 30, 40 years down the line.
Yeah, that's crazy that it can just affect you for the rest of your life like that. I didn't know it like affected that many different things. Um could like it I didn't know it could affect your health in so many different ways like that. Um so kind of generalizing this issue more to the population. Can you like kind of explain to us the main ways that people get hearing loss? Yeah, and like what parts of the ear are affected for like the different types of hearing loss?
Yeah, I think we would break this down into two big facets of hearing loss patterns. So everybody has, well, not everybody, but the majority of people have an eardrum, which transmits sound that goes into the ear canal, and that eardrum sends it to the inner ear structures through the little bones of hearing,
Uh-huh.
your medius, your incus, your stapes bones. And the eardrum and those little bones, when they are not healthy or damaged, like a hole in the eardrum or something has caused damage to one of those little bones or trauma or things along those lines, often can result in what's called conductive hearing loss. So the eardrum is not able to transmit or conduct that sound to the inner ear structure so that your brain can register sound.
Gotcha.
Those, for the most part, are pretty readily fixable. You can go in, you can patch an eardrum, you can maybe replace a little bone of hearing with an artificial one. And that will sometimes restore hearing back to a pretty reasonable range. Some people have pathologies that don't let you do those things. They can still wear a hearing aid, function, and generally do okay, even though they have hearing loss. The other type of hearing loss that people experience is called sensory neural, which implies some component of the inner ear, which registers that transmission of sound from the eardrum, and how it transmits it to the brain, that becomes damaged.
Uh-huh.
And that can be either through the cochlea, which is the hearing organ, which has a bunch of little hair cells, which are respond to changes in pressure and fluid and transmit that sound to a nerve, which then transports it to the brain. And injury anywhere from that cochlea all the way to the brain can cause a nerve-related hearing loss where not only can you not hear, but you cannot understand. So there's no ability to understand or perceive speech or sounds in a normal fashion. And while that has some fixes, like a cochlear implant or other strategies, it's a lot harder to rehabilitate, and the outcomes are less satisfactory once a hearing aid is not providing benefit.
So that means that my dad would have sensory neural deafness.
Correct. And
All right.
he has kind of a both component. So the
Oh.
sensory component um, comes from where we had to remove part of the inner ear to gain access to the tumor. And the neural component is because this tumor was arising from the balance nerves, which were compressing and damaging the hearing.
Yeah. Um, okay, yeah, that's also very interesting. I keep repeating myself, but it's all stuff I haven't known, and I'm sure a lot of the listeners to the podcast did not know. So that is very informative. Thank you. So what are some current solutions to minor hearing loss?
So minor hearing loss, it kind of two strategies. People either put up with it and it's not bothersome enough to deal with it, or hearing aids. So if you've got a mild hearing loss, whether it be from a hole in the eardrum or from sensory loss that's incurred because of aging, etc., hearing aid
Mm-hmm.
can be worn. And I think, think about what you see around you. If you see somebody wearing glasses, what do you think? Often the connotation is maybe they're smart. Maybe, they kind of, there's an association with people being a little bit brainy that wear glasses.
Yeah.
That's not the same perception, unfortunately, that people have for hearing aids.
Right.
People perceive you as old or different or, decrepit in some way. And it's doing the same thing. It's helping you restore these sensory functions, but it's amazing how people perceive it very differently in real life.
Yeah. Just for some minor hearing loss.
Yeah, just because people want to hear you better and have a
Yeah.
conversation.
Exactly. What about like some current solutions to like complete deafness in one ear?
Yeah, there's really only a handful, and most of them are fairly dissatisfying.
Uh-huh.
So some simple solutions, which I think you're familiar with, is something called a cross hearing aid. So
Yes.
ear doesn't work, and you can send it from one ear, sound from the bad side. You can take it, capture it with a microphone, and send it like wirelessly. Used to be with cables before Bluetooth and all this jazz existed, but would send it over to a amplifier in the other ear so that the good ear could hear what the bad ear is trying to hear.
Uh-huh.
That's called a cross hearing aid. It's not intrusive, doesn't require surgery, and just incurs a cost, but isn't entirely perfect. People can't figure out where sound is coming from. It's still hard in a restaurant or a busy place to have a conversation. It's still a pretty difficult thing. People use bone conduction implants, so you can vibrate the skull and accomplish the same thing in a more permanent fashion, where you transmit sound through the skull over from the bad side to the good ear. And some people that really like their cross devices will pursue a bone conduction device and be very happy with it.
Gotcha.
Now, the other strategy, which is kind of a mixed bag, is a cochlear implant. And that's where, like we talked about for sensory loss, if your inner ear is damaged and not working well, sometimes you can take a device that has a little teeny electrode that's less than a millimeter wide and thread it into that inner ear and actually send electrical signals to the inner ear that substitute for what it would have done when it was healthy and send that sound to the brain directly. That's been around for about 40 to 50 years now. And for many patients provides profound improvement, profound quality of life improvements, because an ear that didn't hear can now be restored to hearing fairly well. Not great, not what it once was, but fairly well for some patients.
All right. And how can regenerative medicine potentially lead to technology that can outperform these current solutions that you've been talking about?
Yeah, so I think that's our hope is, you know, if you think about how your ear works. So think about a piano
Uh-huh.
and all the individual keys. If I were to play for you all 88 keys on a piano, you could tell the difference between each note, right? They
Right.
sound different to you. A cochlear implant, which is our best solution for a completely deafened ear and trying to fix it, has 22 contacts.
Oh, yeah.
Only 22. Your ear has thousands of keys in it, and we're instead trying to play it with just 22. So a person who has a cochlear implant, you play a middle C, they're going to hear a range. They're not going to hear precisely a middle C anymore. They're going to hear something that sounds close to it, but it's not going to sound the same. And that's our current problem is everything that we have is coarse, it's crude, it works, but it doesn't work as well as it could.
Uh-huh.
And I think we would love to come up with a circumstance where we could provide a medication or a gene therapy or a cell therapy to go back into that inner ear and put those cells that are no longer working, give new ones. Because those things in the inner ear, you and I are born with the same ones that we will die with. We will never create new ones. We will never make new ones. You got what you got. And if they go bad, we don't have any other solutions.
Mm-hmm.
So if we could somehow figure out to stimulate the body's own stem cells to regrow them or to put new ones back in, maybe we could have those thousands of keys rather
Yeah.
than just 22 to play the ear. And then for cases like, your dad's where the nerve is also damaged, could we regenerate or restore that nerve?
Yeah.
Because those patients that have abnormal nerve function, they can't even make reliable use of a cochlear implant because even though the inner ear is still there and you can put an implant to it, if there's no nerve to send those signals to the brain, you can't get it there.
Right.
So if we could restore nerves, heal them, or restore the inner ear function with the body's own natural functions, how you developed in the first place, it would probably be better than anything we could create that's mechanical otherwise.
Yeah, so kind of going off of that, how does regenerative medicine work? Kind of more in detail than we were talking about before.
That is complicated.
Yeah.
So I did dig in about this ahead of time for you to think a little bit about this. And I think there's a few different ways that people are tackling this. And um, it depends on what part of the body. So people are trying to regenerate nerves, parts of brains. People, I don't know if you're familiar with the little creature, the axolotl and others, that you chop their arms off and they can regrow them.
Uh-huh.
Trying to figure out why other creatures can regrow these and maybe use those same signaling pathways or molecules and reintroduce them into those parts of the body to help restore function. So there's kind of, gosh, I think three basic approaches. One, figure out a drug that can stimulate cells to regrow or restore themselves or create new ones. There's a few of those studies in existence around the world where people are trying to do that for hearing function. The second is to try to grow stem cells or harvest the body's own stem cells to expand them and regrow them. And so you could maybe re-inject them back into those deeper portions of the ear or other structures. And then three, gene therapy. So if we could restore a gene or introduce a gene that we thought could do the same thing, maybe we can put an injection somewhere in deeper portions of the body or provide a gene for restoration where you could reactivate a cell that was, kind of quiet or in stage and turn it back into one that could regenerate those functions once again.
All right, yeah. So, clearly a lot to dive into there, which we don't have time for, unfortunately. But, um,
Yes, it's a lot. It's a lot.
yeah, kind of more specifically, is there a lot of, is there any regenerative medicine being tested right now specifically for the auditory and vestibular nerves?
Yeah, there is, and there's a few clinical trials that are ongoing, and most of them are in deafened patients. So I was poking through, I think, a few places that are doing work on this. Stanford has a big emphasis on cellular regeneration for the inner ear. Um, the Pittsburgh Ear and Eye Institute has some focus on this. Harvard does some of this. Michigan has done some of this in the past. So there's a number of major research institutions that are working on this. Also, there's a study in the United Kingdom. So I saw one where they're giving a compound called Rincel 1, and they're giving it as an injection into the inner ear of patients who are deaf. And then they're giving them a cochlear implant. So patients who get a cochlear implant will either not, or they will get this extra compound to see if they can regenerate or restore some of the hair cells in the ear and see if people perform better with a cochlear implant because the ear is healthier in that regard. And that would hopefully be a precursor to patients with severe hearing loss. Maybe you could give them the same medication or treatment and keep them from progressing to a point where they need a cochlear implant to be able to hear. Maybe you could restore that function.
Gotcha.
So we can start with the most damaged first to see if it's even possible before you take functions away from patients who are otherwise doing pretty well. It's hard to get people to sign up for these things if they have pretty good function, if you might damage it. So that's one of the challenges that we face. When people have already lost everything, they're usually willing to try these new therapies, but they may not benefit the most from it.
Right, right. So kind of going off of that, are there any ethical concerns with regenerative medicine?
That is a sticky question. So, I think yes. And I think that primarily revolves around, I think there's two areas. I think gene therapy is one of those big areas. Um, One of the difficulties that we've encountered is our country has a pretty sordid history of dealing with subjects in clinical trials and has done some pretty terrible things to patients without their consent or permission. And we have a lot of worry and fear as a country about doing those things. So I think our safeguards are pretty reasonable and pretty good. And if anything, probably overprotect at the cost of making it really hard to do complicated, risky studies.
Right,
So I think really trying to not take advantage of patients who are desperate for treatment. A deafened patient will sign up for anything that you can do for them that might help them, even if it's experimental and you don't know if it's going to help them. And if you don't tell them this may not do anything for you, yet they get side effects or problems from some experimental treatment, they may not understand those consequences. So you have to be very careful with those desperate patients before pursuing risky experimental treatments.
right.
So I think that's one of the biggest ethical concerns we think about. There's a bunch of complicated words that we use. We talk about beneficence, trying to be good to people in general and help them. Non-maleficence, trying not to do mean things or bad things to patients.
Uh-huh.
Deprive them of their autonomy, their ability to make decisions of their own accord. So not coercing them into decisions, but also not preventing them from maybe taking risky decisions on their own behalf. So there's a lot of things ethically that go into clinical trials.
Yeah.
One of the complicated places is gene therapy. So for you, me, if we decided to have our genes edited or something, that's our choice, right?
Right.
But could there be consequences downstream, et cetera? One of the sticky places is, what do you do for kids? What do you do for a kid that can't hear? So there's a new gene therapy. It's the first to the market. It's the first trial that has shown we can take a deaf child who has a specific gene mutation, give them that gene back and restore their hearing. Otherwise, they would have been condemned to a cochlear implant, some other form of hearing. But some of these children who otherwise were deaf have been able to have their hearing restored where they can wear a hearing aid. That seems pretty reasonable, right? What
Right.
parent would sign up to have something like that done? But what if it's to change their eye color? What if it is to change their hair length? What if it is to give them 3 extra inches of height so they can be an athlete
Right.
down the road? Where does that transition stop, right?
Right. Yeah.
Here we have pretty significant safeguards. Over in recently, there was a big controversy in China where they decided to edit genes in a fetus for the purpose of basically custom designer gene therapy to try and maximize appearance, other things along those lines. Some fairly ethically problematic
Yeah.
things because the safeguards aren't the same in those certain areas. People can be taken advantage of more. So there's a lot of ethical concerns both here, both internationally. How do we respect people and keep them safe, but yet still offer wonderful and potentially magical, life-changing treatments down the
Right.
road? It's a very hard balance.
Yeah. Yeah, so kind of like, like dog breeding almost, like how they would like just
Yeah,
like pick, like this dog needs to be strong, this dog needs to be like, stuff like that. Like where does it stop? Like
right.
where does a baby become, the difference between like a designer baby and like, just a healthy baby?
Right. Is it okay? Maybe you learn from genetic testing that your child has a life-threatening gene mutation, cystic fibrosis.
Right.
Would you edit that out so they can live a full life? I think most everybody said that if we could do that, that would be a wonderful thing. But yeah, where does that
Right.
where does that boundary end?
Yeah. So finally, kind of what stage of testing, and trials is regenerative medicine in, and when would you expect to see it, make its way to become an option, popular, such as cochlear implants or like hearing aids?
Yeah, so we've been talking about this for probably 15 to 20 years about the potential of these things. Most of these trials and studies are still in animals. So if you needed me to cure cancer in a mouse or give hearing back to a bird or a rat or a mouse, we can probably do those things.
Yeah.
Uh, it's a different ballgame in humans,
Right.
and it's proven a lot trickier. And we are still in a lot of animal model testing and proving phases for many of these things. There are some things moving to humans, but some of the early trials have been pretty disappointing. And
Mm-hmm.
so they've had to go back to the drawing board for many of these things. Um, I would anticipate that we're probably still 10 to 20 years out from seeing meaningful regenerative medicine. I think
Mm-hmm.
gene therapy will be a little bit different. You're going to see that in the next 5 to 10 years to be
Okay.
able to restore hearing for some patients.
Uh-huh.
But I think through cellular restorative regenerative medicine, we're probably still 15 to 20 years out from that being mainstream, would be my guess.
Gotcha. All right, so that actually pretty much wraps up our interview. Thank you so much for answering all of these questions and taking time out of your busy schedule to share
Yeah,
your professional insight with us.
happy to do it. This is a joy to be able to talk to you, and I appreciate the invitation to get to talk and chat about these things that are really important to me and the people that I take care of, and I think
Yeah.
very important to you as well.
Yeah, for sure.
All right, that is the end of the pre-recording. Like I mentioned before, this was recorded a few weeks ago because Dr. Welch is just so busy, and it was a time that worked for him. So, um, yeah, I'm very grateful that he was able to come on here and share his opinions and facts, his facts and opinions about regenerative medicine and, all of the science behind it. And, well, of course, there's so much. It would take hours and hours to explain everything about every type of regenerative medicine. And I'm just so grateful that Dr. Welch was able to give us, a brief intro into that. And I hope that you guys are now further interested in regenerative medicine. And, especially because it, as Dr. Welch was talking about, it could be, very soon in the future, like, within our lifetimes, we could see people in our generation, in generations that will come after us, benefiting from regenerative medicine. And I think that it's just, I think it's a very, very beautiful thing. So, yeah, that marks the end of the episode. I really hope that you just learned a lot about regenerative medicine and how it could, affect us in the future. Next episode, we will be talking to another doctor from a nonprofit. She will be giving us a lot of information about how her nonprofit connects with my dad's story and the science that Dr. Welch explained. So, thank you so much for listening, and I'll see you guys in episode 3.